In this video, we're going to be talking about issues following tummy tuck procedure. A lot of questions being asked by patients. Let's answer the most common questions asked. The first question is, a patient is wanting to know if what can be done for the dog ears after tummy tuck 3 years ago, and how should this be corrected. When we refer to dog ears, these are bulges at the sides of the incisions, and this happens because we are pulling down the tissues, and whenever there is unequal tensioning, there is a resulting skin excess, and these are called dog ears in our plastic surgery parlance. And usually these dog ears are very small and minimal, and they settle down in around 6 months of time, generally with massages and some compression. But in those patients where the dog ears are still unsettled, they're not coming down, then a surgical revision is necessary. A surgical revision is a very simple procedure where the cyst is cut out and the skin is again tucked back so that they have a very flat and a uniform skin. So this is about the dog ears. Now the second question is, my tummy tuck scar is almost 6 months post-op. Do I have a revision? Now the answer to this question is usually no, you don't require a revision usually. Generally scars, they are pigmented or stretched after a tummy tuck. Most commonly we see in our skin type, we see pigmented scars. So in pigmented scars, it's recommended that the patients use a depigmenting cream for up to 3 months so that the scar lightens up. Rarely the scar is of poor quality, where in such cases we recommend a fractional CO2 laser maybe after a month following the procedure. If the pigmentation doesn't reduce and the scar looks not good looking, maybe after a 9 months period, I would probably suggest these patients to go in for a corrective procedure to take down these scars. Now the third question is, 1 year post-op and I'm not happy with the tummy tuck. There's still loose skin, bunching. Is this grounds for a revision? It may be possible that after a tummy tuck there can be some amount of loose skin, but not all of these patients require a revision. Sometimes the excess skin can be taken down by what is called as radiofrequency. You can either give the radiofrequency both internally as well as externally. The external approach is more commonly used. It's called the Morpheus, and here the patient gets multiple sessions of radiofrequency externally so that the skin and the underlying tissues are heated up and it causes some amount of shrinkage. So this would help probably to the extent of around 20%, where you can have some amount of shrinkage. But should you not get any result with the non-invasive Morpheus, the only other option is to probably go in for a revision tummy tuck in such cases where the redundancy is quite a lot. The other question is also about a scar, and the skin is loose, and what needs to be done to the asymmetry after a tummy tuck. What are my options? Like I said, for any pigmented scar, it's wise to use depigmenting creams, and for scars which are slightly prominent and getting more hypertrophic, we may suggest a fractional CO2 laser, maybe 3 to 4 such sessions. For the loose skin, it's not always that we revise the tummy tuck immediately after the procedure. It's best that these patients have some form of external radiofrequency so that the skin is shrinking and gets more even. And should there be no result after the multiple Morpheus sessions, then the only option would be to do a revision tummy tuck.